what we're going to focus on today is supplementation, and what we're going to start with probably is talking about the history of supplementation, and when it got started, and we're going to kind of lean on you, Dr. Jaffe, to kind of help us there. And then we're going to get into the supplementation that has been proven and effective over the last 40 or 50 years. And so we're going to discuss that. And then obviously what you have come to, Dr. Jaffe, as far as the formulas that you found to be so effective in the last 35 plus years. And so that's kind of the flow of what we're going to go through today. So first off, thank you, Dr. Jaffe, so much for your mentorship, for teaching us about nutrition, about supplementation, about doing the hard work, the research of getting the formulas together and putting them together in such a way that they are very close to, as close as they can be, it seems, to food, and acting like food in a supplement form. And so we really wanted to thank you for that work that you've done.
Well, that's a good place to begin, because in 1987, when I started this supplement endeavor, everyone was concerned about packing stuff in. And half of the supplement was a binder, a filler, an excipient, a flowing agent, something that not only wasn't nutritious, wasn't helpful, it interfered with bioavailability. So the industry didn't want to talk about bioavailability. And I thought, if my parents are going to take these, if my kids are going to take these, if I'm going to take these, I want to know the safer, more effective forms, and I want to know the bioavailability, which means they should function like food. Food doesn't need any excipients, flowing agents, binders, fillers, excipients, processing chemicals. No. So every one of the formulas that we have developed is absolutely food-like. That's unusual. That's unusual. Yeah. How do we do that? Well, we have multiple patents. People can go and read our patents. We have done multiple outcome studies to show that better bioavailability and safer forms of nutrients working together achieve superior results. And we can talk about the evidence. We can talk about how we created tabsules, how we created micellized soft gels, how we created dots that dissolve under your tongue, how we created the most safe and effective fiber, probiotics, symbiotics. We pioneered recycled glutamine, so you could get the benefit of the energy from the glutamine without building up glutamate as an excitoneurotoxin. We specialized in nature's form of ascorbate. What is nature's form? Nature's form of ascorbate is fully reduced, fully buffered, and all L-ascorbate. In order to do that, you have to produce the product under a nitrogen blanket to keep oxygen away from damaging the vitamin C. Almost all vitamin C that's sold in this country is done under air. It's produced in air. It comes in a damaged form. I don't want damaged forms. I want nature's form, and I want nature's balance. Mm-hmm. It turns out if you give one of the 8 forms of vitamin E or one of the many carotenoids that are necessary, and you give that one isolated form in excess, you're doing a kind of pharmacology that I predict will be unhelpful, and they have published studies showing how unhelpful that is. What they didn't point out was how helpful all 8 forms of vitamin E are with selenomethionine. What they didn't point out is how helpful all the carotenoids are when they are bioavailable, when they are micellized. How about the CoQ10 in 100% rice bran oil? Because Carl Folkers showed that if you wanted to get CoQ10 in, if you wanted to have bioavailable CoQ10, it needed to be in 100% rice bran oil.
Mm-hmm. Yeah, and I
Well,
think that
there are lots of little nuances. We could get into the details, but I don't think we need to. I think the point is that we have pioneered emulating nature and produced superior products because of it.
right. And I think that speaks to, it seems, the history that you've gone into and examining when supplementation started, and how they did it and why and all of that. And one of the things I would like to ask before we kind of dive into that aspect of it is, Steve, you got in connection with Dr. Jaffe not too long after he started the formulations in '87. When was it that you first got connected with Dr. Jaffe and found out about his formulas? And what were the first formulas you were taking?
In the first annual event of the International and American Association of Clinical Nutritionists in 1991, I was there, got to hear Dr. Jaffe as he was the MC of the event. And so we brought in as many specialists of all different likelihoods. And we had the cardiologists and gastroenterologists, and the ones that specialized in somewhat of their functioning understanding of different biochemistries. And so they did their presentations. And what was remarkable is Dr. Jaffe, so well read and understood in biochemistry, at the end, he was fielding questions from the audience after the speaker would talk on his particular topic. And after the speaker would answer the question, then Dr. Jaffe would fill in the gap of maybe missing information, and possibly, and it happened a few times, of correcting some errors on the speaker's part, just because it was such a passion of his. He'd been so well studied it for so many years. And of course, some of those professionals were a bit taken back, but of course, we in the audience were enamored by Dr. Jaffe's wisdom. And so many people have followed since that day. And he's got a great following today because of the wisdom that is God-given, of course. And he just searches out a thing and makes it into something that can be utilizable, that's not overwhelming. And that's what drew us when we saw him. He was sitting out in the waiting room. I didn't get to personally meet him until after the event. He's waiting. They're considering how to get to the airport. And Amy and I, my wife, walked up to him, and he had his assistant with him, and we just started a conversation. And he's very matter of fact and just so open and friendly. And he said, well, if you'd like to know more, there's about a 30-minute drive to the airport. And if you have an automobile, you could escort us there and we could talk some more. So it worked out great. We were able to take him to the airport and get more of an earful of his blessings. And we're just so thankful to have him today on the topic of digestion.
Yeah. Well, and so you got connected with him about 4 years after he started distributing the formulas.
Right. 3 to 4 years. Yeah. As Steve correctly said, we met through IAACN. I had the privilege of being the education coordinator or curriculum development person for the first 8 years of the organization, because we wanted quality people and we wanted the audience to understand what they were saying and where I agreed and disagreed, but what they were saying. And we didn't have any money. It wasn't a big deal organization in the beginning. But for a variety of reasons, I was usually able to get quality speakers that were talking sense. And then you should fill in the gaps. Yes, you should say another point of view if you have another point of view. So someone should fill in that role of MC, as you said. And I was privileged to do that. And I remember fondly how much work it was, but how rewarding it was to have an audience that was so receptive if you made sense.
It's good. Yeah. So, Steve, what were those first formulas you remember taking that Dr. Jaffe had in 4 years after he had started that line?
Well, I was involved in some supplement companies and influenced not as strongly by Dr. Jaffe. And so I didn't get on board for probably a year or two and started, of course, the Ascorbate. I remember looking at 96, I believe it was, we started to operate a dark field microscope and look at the neutrophil activity and you saw the effect of the L-ascorbate on the motility of a neutrophil was just amazing. And we'd never seen anything like it on any other forms of vitamin C that we'd use, because it was a primary fuel that a neutrophil has 28 times the amount of ascorbate in it than any other cell in the body. So it's very active, it's very volatile, and using that for killing microbes, bacteria and such. And of course, then regenerating. Those cells don't live very long and they have to make more and get refueled. And here I am 30 years later, learning more and more of the effectiveness or the frequency of that, having the flu last year and using it myself now 4 times a day, some days 5 times a day. And that was even suggested in the LRA test as it came back. And I read it last year, but thought 4 times a day, that's a lot. But I needed that as a therapy to bounce back from the flu. So we started implementing ascorbate vitamin C. We call them the C cleanse. Is that right, Dr. Jaffe?
C cleanse. That's what it is.
And the C flush.
Well, we used to call it the C flush, but more people will do the C cleanse than will do the C flush. It's the same thing, but it's now called the C cleanse because it allows you to get extra fluid and toxins safely and effectively out of the body. It's very distinctive. If you've done a C cleanse, you know what I'm talking about. If you haven't, you have the experience yet to come to you, because the amount of vitamin C that you need is very individual. You cannot assess it objectively from the outside. You have to test, for example, the C cleanse. And yes, sometimes you need more and sometimes you need less. And when you're bouncing back, you might need substantially more. And that's okay. You take the ascorbate with polyphenolics, the quercetin dihydrate and the soluble OPC that synergizes with the ascorbate. But yes, nature's ascorbate is quite distinctive. And certainly for many years, and as far as I know still, we're the only company that goes to the trouble of protecting the ascorbate in production so that it can be more effective when it's inside you.
I have to tell a testimony on the ascorbate. When we first used it back in the early 90s, a particular patient had been to Russia and was contaminated with lead from the water supply. Came back to the United States. They actually did a scope on her colon because her colon was just locked up, and the colon had turned black from the lead. And when she started, the large container of the L-ascorbate powder has 242 servings. She had to purchase 2 bottles per week of the large to get the colon to move and to start to mobilize that lead out of her system. And within 3 months' time, all of that heavy metal was cleared. She was restored to normal colon function, and her normal ascorbate use was well reduced. And I think then she was getting a large bottle once a month. Mm-hmm. But like you said, every individual has certain contaminations that they have to deal with. And that was the most remarkable thing I've ever seen, even to this day, that type of contamination that happens in the colon. So it is a staple for everyone that comes into the clinic. We put them on the L-ascorbate and immunity takes off, connective tissue, even the collagen repair. There's so many collagen products out today. And knowing what Dr. Jaffe did in his dissertation, and his professional understanding of collagen, I just trust in that. And it's remarkable. And you can see it in my wife. My wife is one of, I hope none of the sisters are offended at all in listening to this, but a lot of varicose veins in the family. And she's the only one that doesn't have out of 8 sisters. And we attribute that to the L-ascorbate and the collagen preventing capillary fragility. Just remarkable, the extensiveness of what ascorbate does for the body. And so we store it up and keep it going.
And to jump in on that, you do not build collagen by swallowing collagen. You don't.
Agreed.
You build collagen by energizing the cells, including granulocytes and other dendritic cells, wiggly cells, cells that go all over the body looking for what's worn out and what needs to be replaced. And it's a very elegant process that, yes, I helped decode, help understand. Then I helped understand how collagen activates platelets. Because if you understand platelet function, if you understand how these blood clotting, very elegant fragments of a cell called a platelet, how they work, how they nourish the endothelial cells, to jump to the conclusion, I can predict 20 years ahead because of hypercoagulation of the platelets, cardiovascular events. That means stroke, heart attack, and blood clots. I'm telling you that if you measure platelet function properly, you can predict 20 or more years ahead cardiovascular catastrophe. And if you want to reverse that, start with ascorbate, include polyphenolics, get to magnesium and choline citrate quickly. And yes, you need a multivitamin, multimineral, such as the one that we did the double-blind placebo-controlled trial of, daily, sufficient to keep your urine sunshine yellow. We can even tell you how much to take based on your body's response. It's very personal. It's very individual. That's an easy concept that it's individual. It's a much more difficult, challenging concept to implement individualized protocols, individualized practices, individualized therapies. Let your food be your medicine, let your medicine be your food, but that includes today supplementation. Food-like supplementation, quality supplements like quality foods, because the 21st century is a hazardous place. All sorts of anti-nutrients are all over the place.
Mm-hmm. Yes.
Many more than there were even 20 or 40 or 60 years ago. So it turns out most of the science that was done in the 19th and 20th century does not apply to today. We have to rethink the whole health equation, and our conclusion is go to the cause, go to the essential nutrients that are needed, and then see what else is needed. Is some attitudinal healing needed? Is some stretching needed? Well, we'll get to that too, but one step at a time.
That's good. I appreciate that. And that, I think, leads us into a little bit, if you can, Dr. Jaffe, share what your understanding is when supplementation came about, specifically vitamin and mineral supplementation, around when that started. Obviously, we know that for many years, hundreds and thousands of years, millennia, like salt has been used, and that's a big part of it. But it's not necessarily the industry that it became in the modern day.
No, so I want to answer the question you asked, not the question that followed. If you want to look at the history of Paracelsus or Hippocrates or Maimonides or Avicenna, I'll be happy to talk at another time about that history. What I think you're asking about is what is the modern history of supplementation?
Right.
And I happen to know that in great detail because I overlapped with the giants who created that world. Earl Statman, Herbert Bailey, and others. I could go through names that you wouldn't know, but I did know them. Albert St. Georgi, Linus Pauling, you might know of them. I knew them. The history of supplementation is fascinating because many of the leaders at NIH, many of the leaders at the food side of the Food and Drug Administration, including Jean Maillet and other giants of that time, they were certain that the future of healthcare was prevention, and that core to prevention was supplementation to equal or exceed the anti-nutrients that we were getting exposed to. They absolutely knew that in the 1960s. It started in the 50s. It continued in the 60s and 70s. It stopped in the 80s. From 1980 forward, NIH, like every healthcare government agency, was so preoccupied with pharmaceuticals that it forgot about nature, nurture, wholeness, It forgot about nutrients. In fact, it very often said pejorative things about nutrients that were wrong. And I am among the people that showed that they were wrong. And we're still friends. They're nice people. You can be a nice person, you can be a friend of mine, and still be wrong. So if you want to get into the history of B vitamins, you want to get into the history of ascorbate, if you want to get into the history of essential fatty acids, if you want to get into this history of CoQ10, they each have a different history. They each developed entirely outside the government system after 1980. Before 1980, they were absolutely part of the home team. The people that I was mentored by were giants of biochemistry and physiology and prevention. The man who ran the National Center for Health Statistics for many, many years, Kerr White, was a big fan of prevention, and he didn't trust pharmaceuticals. Isn't that interesting? So there's an elegant history. We could spend as much time as you'd like going through each specific category of nutrients and how its history emerged, what the evidence is that it works, what the evidence is that it works in synergy with other nutrients and not in isolation, why you should not just take one nutrient and presume that you have an answer to a health problem. The giants of that original time all understood synergies, biochemistry, physiology, homeostasis, primary prevention. And that's all changed.
Yeah, one of the things that we wanted to ask you about, Dr. Jaffe, your understanding of, like, for example, it looks like it's Casimir Funk had to do with coining the term
Casimir Funk deserves to be remembered because he coined the term vital amines, which became vitamins. He like Metchnikoff and Ehrlich and who else was in that time? Rankin. They were all giants who anticipated by many decades what other people documented.
And that's when, I guess, around the same time is when they started developing vitamin formulas or just vitamin supplements, I would imagine.
No. At the time of Casimir Funk, they were just figuring out what was essential that the body couldn't make and how much of that it needed and in what combinations. No, that was not the age of supplementation. And frankly, at that time, there was less bad and more good in the environment.
Okay. So they were more like, there's one information here, and maybe you can clarify. It says there was, the AMA was involved with developing something called Ascorbate, a sugar-coated tablet of vitamin A and D made from cod liver oil. So that seemed to be
what is the question? Because it's a leading question. I want to give an answer to the question. What's the question?
Well, we're just wanting you to clarify that it says it was developed by Funk in the early 20s, and so sounds like it's a sugar pill, but it has vitamins in it. So that's something.
Well, actually, that led to the massive misunderstanding of vitamin A. Because inadvertently, Casimir used vitamin A that had been exposed to air. It was oxidized retinol. It was damaged vitamin A. And what that proved was that if you give damaged vitamin A, the more of it you give, the worse it gets. They hadn't yet figured out that beta carotene is a water-soluble form of carotenoids that can be converted safely in the body to vitamin A. But then they jumped on beta carotene as the only carotenoid that was interesting because it converted to vitamin A. But you need all the carotenoids, not just beta carotene. So with regard to Casimir Funk, he knew who and he knew how. He had friends in high and low places. He took no prisoners. He was sure that he was right, but unfortunately he was wrong. Well, the facts are different than what he thought it showed.
Right. Yeah. I appreciate you saying that, Dr. Jaffe, because that kind of confirms if one really wants to do some digging into the science of recent history and the competing theories and methods, there's usually that type of leveraging happening.
Where you should start is with a book by Herbert Bailey called The Vitamin Pioneers. It's an objective history of each of the nutrients, who did what to whom, how and why. The Vitamin Pioneers by Herbert Bailey.
Thank you. Yes, we will. We're going to dig into that. So that kind of leads us into, obviously, they were doing research and finding and learning about vitamins, vital amines, right? And that was happening for what reason that you remember? Was it because of industrialization? Was there connection with industrialization that was happening? Because you mentioned the processing of foods and so many more chemicals being, people being exposed to chemicals and causing some severe health issues and concerns. And so is that related? Is it connected?
The answer is in Latin. It's Posthoc ergo Proctor hoc, which means after the fact you can look and see differently than what really happened when it happened.
Okay.
The people who were pioneers in prevention using essential nutrients were absolutely certain that prevention was the way to go. They led NIH. They led institutes. They led major laboratories at NIH. Then came the 1980s, and for the first time in history, the budget of NIH was cannibalized. And I mean that, cannibalized. The federal government was looking for money. They couldn't touch the Department of Defense. They couldn't touch Medicare and Medicaid. They couldn't touch a whole bunch of entitlements. Vulnerable was the NIH. Why was it vulnerable? Because it depended on investments today that you don't know the outcome tomorrow. But NIH had generated more Nobel Prizes than anywhere else in the world, so it really deserved to be supported. The support for NIH was generous up through the late 1970s. Starting in 1980, Reagan came in and they wanted money to do certain things, like drive the Soviet Union into bankruptcy. And NIH became cannibalized. NIH became politicized. So the NIH of today is not the NIH that I was in, because I was at the NIH in the 1970s. It was wonderful. It was a meritocracy. It was still a time when prevention at the highest level of authority was the way of the future. That changed. What were called CRADAs. If you want to get into the details briefly, we can. These were called cooperative research agreements made between pharmaceutical companies and academic medical centers, because all the academic medical centers felt the budget cut when NIH, which gave out the money. There was intramural, which I was in. Then there was extramural, which gave out billions of dollars. And when that dried up, medical centers all over the country were looking for money, and the only place that they were offered money were cooperative research agreements by pharmaceutical companies that said, we're going to give you money and you do anything you want. No, that lasted a very short period of time. And then the people who were giving the money told the people that they were going to work on pharmaceuticals. And there was more than enough need to research pharmaceuticals. And have you ever heard the phrase, follow the money?
Yeah.
Well, follow the money. The pharmaceutical industry bought the healthcare industry. The Food and Drug Administration was at one time two separate government agencies under one umbrella. The Food Agency had Sanford Miller, a very powerful, very important, very knowledgeable, very nice, very biochemically prevention-oriented guy, Sanford Miller. He was the last strong director of the Food Agency of the FDA. Since then, the drug side of FDA has provided the director for the food side. So the food side has languished and the drug side has prospered. Follow the money.
Right. Yeah, and that appreciate you explaining that, Dr. Jaffe, because that kind of goes back to one of the points you made a little bit earlier, in that if we're going to be getting, it seemed like you found out that if we're going to get the best quality supplements that get results, people like yourself who became independent and did the hard work, we're going to have to do it. Would you say that's right?
Yeah, no, yeah. That's exactly what I'm saying. Yes, the innovation has to come from the outside. But most innovation is about how much money can I make in how short a period of time. And whoever innovates most in that area wins the lottery. On the other hand, I spent an entire year trying to get someone, because I was already running a lab that was doing very well. Eliza Act Biotechnologies was revolutionizing immunology. Autoimmunity was us. So I wasn't really looking for another company. I spent an entire year trying to get someone in the supplement industry to do what I thought they needed to do to differentiate themselves, and what became the PERC promise. All good, no bad, help ever, harm never. That's our guiding North Star. And I continue to run the company because I want people to know the guy who runs the company is a doctor. He can say biochemistry. And he pioneered what he now delivers. And you can just accept the delivery because it's more bioavailable, it's safer and more effective. But there's a lot of hard science that we pioneered and that others have also pioneered. The difference is I didn't come out of the supplement industry. Mm-hmm. I was closer to the food side than to the supplement side. And so I thought, how do I emulate nature to produce more bioavailable supplements that have more active ingredients that are safer and more effective than anyone else? And we have done that throughout the entire line.
We're so thankful that you've done that, Dr. Jaffe. It's been a blessing to our family and to many others. And so we're excited to continue to share your formulas through our companies. And we're very, very blessed to be able to do that. Steve, do you have any questions to bounce off of that? I want us to dive into next, just a little bit of the details about why supplements are important and what you've found, what formulas, how you found the formulas that you did find to be most effective.
Yes, let's get into that topic. That's the way that I think we should go with this discussion, because people are going to want to hear that. They're going to want to understand that. So many people are making wrong choices based on profit desires of companies out there rather than biochemistry. And we have these formulas that we private labeled because we trust them, because we know that they work, because by word of mouth, it has spread like wildfire. And we will continue to do that so that people can get well and influence their families. And that's why we went to private label, so they too could invite their families as a part.
Yes. So, Dr. Jaffe, we've talked a little bit about it, but what we'd like to hear a little bit more of is why you found, like, when you came to that conclusion of why supplements are so important for people that are wanting to recover their health and wanting to live a long, healthy life. And then, kind of segue into the formulas that you found, how you figured out these formulas were so effective for people.
Well, the first part is that I had the great good fortune of being at NIH. And so if I had a question, someone had an answer. I could get to anyone in regard to food, in regard to supplements, in regard to anti-nutrients, in regard to nutrients. We've actually just digitized some of the slides that I used before I even started the lab. So this goes back to the early 1980s, late 1970s. I was saying the same thing then. Yes, I was somewhat a guy in the wilderness speaking truth to power when it didn't want to hear my message. But what has been validated over the last half century are what we do today and what we bring forward, including as the quality, safer, more effective PERC supplements. Because what I started with was the lab, and I knew that in order to do the lab's service, we had to have full disclosure supplements. We had to have everything that was in the product, in the form that it was in the product, on the label. We pioneered that. I couldn't get anyone else in the industry to do that. They said it's too much trouble, it costs too much, no one will care. There's a lot of reasons to say no. So we partly started PERC to have full disclosure products. Because we are full disclosure, we chose the superior ingredient and combinations of ingredients and balance of ingredients so that in our super multivitamin, we have 40 ingredients in active amounts. Most multivitamins have 18 or 20 in minuscule amounts. Then we brought out the Ascorbate, done under a nitrogen blanket because we wanted to emulate nature. Always. Help ever, harm never. That's an anthroposophic comment. So I have been cross-trained. And by that I mean I was trained in internal medicine, then I was trained in laboratory medicine, then I was trained for 7 years in Chinese medicine and acupuncture. Then I had 5 years with Dr. Mishra, who taught me yoga and Ayurveda. Then I had 30 years with Bhante Dharmawara, who taught me the color healing system, etc. So I'm kind of cross-trained. I apply all of that to developing the new formulas. Now, many of our formulas are patented. We have patents on polyphenolics for repair and pain. We have patents on enhanced magnesium uptake using magnesium and choline citrate. We have patents on recycled glutamine and others. And we've done outcome studies in type 1 diabetes, type 2 diabetes as the classic autoimmune disease. We've done fibromyalgia as the classic mystery syndrome. And in all cases, in every one of our outcome community-based controlled studies, this is properly controlled, we improved on the best standard of care by substantial amounts. In regard to diabetes, we reduced the hemoglobin A1C by full 1%. That means we added 20 to 30 years of quality life to the people who participated in our study, compared to the control group, which didn't change. In the fibromyalgia group, we had, in just 6 months of best effort in the community, 50% less pain, 70% less depression. We have continued to follow these people over many, many years, and they have continued to do well. So one of the reasons that people say don't give supplements, people will live longer and spend too much money. No, it turns out if you're well hydrated and you're well fed, that includes supplementation in the 21st century, and you stretch, and you appreciate, you have some level of gratitude, you will live years and years longer at low cost compared to the 1 million people a year that we bury in this country early at very high cost and with a lot of suffering. 1 million people, 500,000 from diabetes and its cardiovascular and cancer complications, 250,000 from nutritional deprivation. We have nutritional deprivation in the United States. Have you seen what they feed in the hospital? And then another 250,000 because in America, healthcare is a privilege, not a right. In the rest of the world, almost all over the world, if you're a citizen of the country, you have healthcare. In America, if you want to know who's healthier, look at the zip codes of how much money they spend. Now we're getting to the point in the 21st century where if you spend more, you might get worse care. For example, if you're in Denton, Texas, which is not too far from you, you are 10 times more likely to get a stent and have a complication than if you live in Grand Junction, Colorado. So my friend Don Berwick matched up these low cost with high cost towns. It turns out the low cost got better results. The high cost had more complications. The doctors from Denton, Texas came up to Grand Junction and they met for 3 days to understand what was going on in Grand Junction. And then they went home. And the first question the doctors in Grand Junction asked was, how do we get a private jet? So you have to be careful when you get the high cost and the low cost together. So yes, we have done what you would do if you cared about nature, if you cared about nurture, if you cared about wholeness, you would do what we did. We pioneered because no one else was paying attention at that time. Fortunately, today, bioavailability is a big issue. And the fact that our products are safer and more effective is noticeable by the consumer. And you're absolutely right. Word of mouth is the best advertising. My father taught me that.
Mm-hmm. This is very helpful, Dr. Jaffe, and we're really looking forward to sharing this information with the people that are seeking us for help. And so we're very appreciative. Steve,
yes,
do you
if you start with the 4 self-assessments and then you move on to the predictive biomarkers, because one of the things we did and pioneered was the question of lifestyle. How do you measure your lifestyle, your epigenetics, your habits of daily living, what you eat and drink, think and do? How do you measure how well you compare with the best outcome value for that test? And it turns out you can measure all of epigenetics on 8 tests, not 8,000. We screened over 100,000 tests. We had to have information from every socioeconomic group, from every demographic group, from every geographic group in order to qualify for these comprehensive predictive biomarker tests. So if you really want to know, you start with the self-assessments. They will convince you that you need to move forward. If you give the predictive biomarker tests and then you say, how do you compare with the best outcome value? For hemoglobin A1C, it's 5%. For HSCRP, high sensitivity C-reactive protein, it's 0.5. Homocysteine, it's 6. LRA, it's tolerance. You should be non-reactive. The real goal of the LRA program is for you to be tolerant to the world. Therefore, you can repair as well as defend. Because I'll tell you a secret. If you want to avoid cancer, you need to have an immune system that can repair. Repair includes identifying abnormal cells that people make every day and eliminating them. This is a process called apoptosis. It's a Greek word. So we now know enough in the 21st century to thrive. Based on 4 self-assessments, 8 predictive biomarkers, including the health appraisal questionnaire, and then you get back a personalized lifestyle program. The more you do of what we recommend, the healthier, the happier, the more grateful, the more restored you're going to be. And the bonus is you'll eliminate cancer cells.
Mm-hmm.
Well, that's a pretty good deal.
That it's a great deal. I'll take it.
If you'll take yes for an answer, we have a question.
Well, that kind of covers the main points, and I think our time is about up. So thank you so much again, Dr. Jaffe.
Thank you, Dr.
I'm
Jaffe.
so glad to get into this depth and detail. And you asked many of the right questions, but if you're willing to invest in yourself, you can thrive in the 21st century. With your help, Steve,
Mm-hmm.
you can guide people to what steps to take next so that they too can thrive and not just survive. And we want everyone to thrive, not just survive.